Hello and good morning. Actually, it's just turned noon, so yeah, it's afternoon. So good afternoon, everybody. It's a beautiful September day in Greenwich, Connecticut. Welcoming, sitting next to me right now is State Representative Lucy Dathan. She is from the 142, which includes Norwalk and New Canaan. Just before we sat down here, we did have to just take a little nod, listened into Pete Hegseth's latest conversation to over 800 generals. By the way, everybody, are we safe with all those guys, people sitting together? Does that make us safer in the world? I don't know. I'm a little concerned about this, Lucy. But
and who's leading the troops
and
is what I want to know.
Leading the troops. I mean, hello, this is just mind-boggling. But I guess one of the takeaways is no more beardos.
That is what I heard.
Yep. Clean shaven, everybody, unless you want to be special forces. So that said, I really am delighted to have Lucy Dathan here with us. She has just given me her latest mailer. I'm going to show it here on the video because we will be posting that later. But Lucy's been doing some really important work here in the state of Connecticut. She is co-chair of the Government Oversight Committee. This past August, they had a presentation by the Department of Child Services, DCF, and talk to me about what their findings were, because anybody listening to this should be really disturbed, and this is very important for all of us to understand.
Thank you so much, Trevor, and it's a pleasure being here today. So within my committee, we look at audit reports, other performance reports by the government agencies sitting in the executive branch. And generally speaking, we look at any agency and have them come before us if there's sort of irregularities or if there are issues that come up in any of those reports. DCF's report was issued in June, and there was a few comments that came out that were pretty alarming and disturbing. And probably the biggest one was hearing about how some of the kids were getting lost in the system. When we had the then Commissioner Hilili come in, it was actually her penultimate day within the agency as commissioner. She came in and she described what has happened since the findings that came out in that report. But one of the key things that she had highlighted was talked about the epidemic rate that kids are being trafficked for sex. And hearing that was a real wake-up call to so many people. We've talked about it within the legislature. One of my good friends, and she is the co-chair of the Human Services Committee, Jillian Gilchrist. She's chair of the Trafficking Council and the Gender Responsive Working Group for the JJPOC. And this is something that they are laser focused in. And so we've had some conversations and talked a bit about what Connecticut is doing to address this problem.
Okay, anybody tuning in right now, this is Trevor Crow. The show is Trevor and Friends. I am sitting with Lucy Dathan, Connecticut State Rep from the 142 Norwalk, New Canaan. We're discussing a huge, very, very disturbing problem right here in Connecticut. And I'm sure quite a lot of you, and myself included, didn't realize the extent of what's going on. We have human trafficking, specifically child sex trafficking, right here in Greenwich. And you said something that was really disturbing. You said many children are getting lost in the system, Lucy. What does that mean?
Well, there are different classifications that they have within the groups in DCF. And there are kids that go away for maybe just walk out of the house that they're foster home or within the group home that they're staying. And generally they know where they are and they come back. There are some kids that have gotten lost in the system. And one of the key things that they are looking at is they've upgraded their systems and they've upgraded their sort of back office sort of workings to ensure that they have a better idea where things are. A lot of these group homes are not locked down for one, safety reasons, but also that's part of the sort of methodology that they do. There was definitely a strong follow through by the committee.
Mm-hmm.
A lot of it was a documentation issue, is what we kind of learned. But with some of these kids, they come from home lives that maybe don't look like your sort of typical home life,
Mm-hmm.
and they get into DCF without loving parents or loving families to help care for them, and so they fall into these situations where they are trafficked, because they're getting the love and attention, and because of attachment issues. It sounds like these.
Attachment. So, Lucy, what is the age group and gender of these young people?
A lot of them are in the sort of 12 to 17 group. And so, that was the kind of thing that we heard the most about. But I mean, there's good news. Last week in Hartford, 7 men were arrested, and they found 3 girls, which were safely recovered and returned to family members that could help. There are nonprofits that deal with this, that support human trafficking victims. There are agencies in New Haven, Love 146, that is one that is doing incredible work right here in Fairfield County to address this issue.
Again, sort of reintroducing us, this is Trevor Crow. Our show is Trevor and Friends, speaking with State Rep Lucy Dathan from the 142. We're addressing a very serious and long-standing problem. This has been many years. I know you guys are addressing it right now. Thank goodness you're really listening and you're putting some money towards these. We have some not-for-profits helping these young people who are getting trafficked. But one of the questions, or one of the things you're touching on here, are the root causes of how these young people end up walking out of their group homes or their foster homes, where they don't feel that strong attachment, the sense that they are safe, they're loved, they're seen, they're heard, they have this sense of belonging. Those are things that we know are truly important to any person's development as a human being, so that they feel like they are lovable and worthy. So if they end up in a conversation with someone, say a predator, who wants to make them feel loved, safe, seen, it's not very hard for them to get drawn into that sort of activity and that sense that they're going to be okay with this person who's actually going to hurt them. So, is there anything we can do as a state to address those types of issues? As a therapist, I'm trying to get my head wrapped around that myself.
Well, the reason of the increase is really post-COVID pandemic. Just exacerbated the issue. As I said, we have some amazing nonprofits. Underground New England, which is the one in Hartford that does support these trafficking victims. They are currently helping 24 victims from 20 different communities in our state. And as Commissioner Hill-Lilly said, this is happening in a variety of places and families that look like yours and mine even. And one of the other issues that has also exacerbated it is the online trafficking and online predatorial activity that is happening. And so this year in May, there was a report that was issued that said that there was about a 200% increase from 2022 to 2024. So as a result, and I talked a little bit about the Trafficking Council task force that Representative Gilchrist is chair of. She's kind of led the effort for a public act that we did this year regarding human trafficking and sexual assault victims. And what it does is it extends protections for employment, housing, public accommodation, and other even credit transactions to make sure that they are able to be financially secure for victims of sexual assault and human trafficking.
I am so glad, and I'm feeling hopeful that you and Senator Jillian Gilchrist are taking this on and looking at ways to ameliorate this absolutely awful problem. And I know that so many of us scream and yell about Jeffrey Epstein and all of the horrible things that that man did. And at the same time, everybody listening in, this is a clear and present constant danger, and it's happening right here in our very own state. And I'm so glad to hear that you were all able to arrest 7 men recently who were preying upon a bunch of young girls. They rescued 3 girls. As you said, the Underground New England group is helping 24 victims. So as a state, we're addressing a very horrible problem. Now, anybody who's listening, what would you suggest if they care about this and they want to do something about it? What could they be doing?
Well, as you said, it's a serious issue, but one of the key things is community awareness and understanding some of the symptoms that signals that people who are being trafficked are showing. And these where local organizations are having a strong impact. There is a group called HEART, Connecticut's Anti-Trafficking Response Team. They collaborate with the law enforcement and other service providers to identify and assist victims. And again, the Connecticut Alliance to End Sexual Violence has 9 member centers within Connecticut that offer free confidential resources. And there are hotlines. And I think, what we need to do is make sure we get the word out there and really not to stigmatize victims of this and realize that, these are people who are having issues that they need to have that love and support for.
And that's an incredibly important way to look at it is we cannot stigmatize the victims. These are often young people who really are just, really wanting to be loved and feel worthy and appreciated and seen. So I love that we have hotlines that you've mentioned. Connecticut Heart, there's Alliance to End Sexual Violence. There's a group of people who are doing their very best to bring community awareness, but we all need to do this amongst ourselves. So anybody listening today, I really do want you to pay attention to this. Yeah, and you just gave me an incredible statistic. This has increased by 200% from the years 22 to 24. That's heart stopping. And we just have to develop more strategies to cope with this. And I'm so glad, Lucy, you're bringing our attention to this right now. Again, on sort of maybe an individual level, what are some of the tells you might suggest if somebody is seeing something problematic? What are the characteristics of someone who might end up in this issue with this issue?
That's a great question. We, if you go to some of the resources that I talked about before, they kind of highlight some of these issues, but they talk about kids that are withdrawn, feeling, kind of taking themselves out of a situation where they just really want to be, kind of introverted, if you will, and
so they're sort of isolating themselves, maybe being online more.
Yeah, especially if they have access to that sort of, online presence. We're seeing a lot of issues, but going to any of these sort of resources that I talked about are fantastic. I know NPR did something earlier this year and talked to a family medicine specialist that talked about some of the issues that she said and where there are gaps in the system. But we are, this is continuing to go forward.
It's very important. And you're just sort of keeping me aware that, if you're a pediatrician, you're maybe a dentist, you're maybe somebody who's on the front line who does interact with these young people. Maybe, that group of people can see things up close and call it out and start making steps. So what would somebody do, see if you thought you saw a child in a dangerous situation, would you suggest they call DCF? What are the steps they should take immediately?
There are different avenues. I mean, right here in Greenwich, Greenwich Hospital implemented a new training program for ER staff to help them recognize the kind of key indicators of human trafficking. Some of these kids come to the emergency room without identification. They're showing signs of emotional trauma, other sort of substance use issues, maybe paying for services in cash, or even being accompanied by someone who's constantly answering questions for the patients. I know some of these resources will kind of quietly say, answer the questions in red pen if there is an issue, rather than the black pen if there's not an issue. So it's a way that there is an ability for people to kind of reach out. But most of the times we're finding, well, from what I've read, is that the emergency department is some of the first areas. But, again, there's teachers, other sort of school counselors that might be seeing these sort of issues. But reaching out to DCF, reaching out to law enforcement is really the best thing to do.
Well, Lucy, thank you for your service. Thank you for paying attention to something that is really just deeply disturbing and important to all of us. We need to protect our most vulnerable populations, certainly our children. We certainly, it's a horrible thought that we're seeing a 200% increase in sex trafficking and human trafficking here in the state of Connecticut. So thank you for all the work you're doing. So before you go, because we got a couple more minutes, I want to take a look at this beautiful mailer you sent out. And I'm going to hold it up again for anybody who's going to be watching the video. But talk to me a little about the things that you are going to be focused on in the upcoming legislative session, and maybe a couple things that you got done or you're particularly proud of since the last session.
Well, right now I am laser focused on Medicaid and what is happening. I know you and I have spoken before about what we're seeing, but even more importantly, we are hearing from Access Health, which is the Connecticut portion of the exchange, insurance exchange, and hearing how many people are going to be affected by the tax sort of credits that end tonight at midnight. And because we do not have our federal government's looking towards a shutdown, our federal Democrats are 100% trying to get this resolved, because we are seeing up to 75 to 200% increase in premiums. Somebody who might be currently paying $500 on the exchange might even go up to $1,200, $1,500 as a result of these tax credits expiring.
You are speaking directly to somebody who's going to be directly impacted by this. And I recently had a conversation with a dear friend who said, you know what, Democrats just really want to fund undocumented workers to be on this exchange, and this is really just about us wanting to increase our votes by having undocumented workers on these roles. Is that true, Lucy?
So just for the avoidance of doubt, somebody who has access to Access Health has legal standing.
So like me, they would have a social security number.
Social security number. They might be
born in the United States of America, which I was in Boston 1962, either February 24th or 5th. It's unsure, but that's another story. But anyway, this fight at the federal level is not about undocumented workers. This is really about protecting our own rights, and I personally am going to be very impacted by this. So
many young families are, and so many people who do not qualify for Medicaid are going to be affected. And people are going to start seeing letters, renewal notices starting this month coming up that start in January, that are going to say, okay, your new premium for this. The real risk is that the people who need the insurance, that have health concerns, will pay those additional premiums, but the healthier sort of younger families, maybe that can't afford this initial amount, will forego it. So then you have an insurance pool of more unhealthy people, and less sort of well people that are actually helping support the insurance system. That's the sort of tragedy.
So we're watching the federal government attack what was once called Obamacare, which is now called the
Affordable Care Act. Yeah.
Affordable Care Act. Thank you. And they're doing so by allowing these tax credits to disappear, to expire. So one of the reasons why there's this potential shutdown midnight tonight, I believe, is regarding this particular issue. And I just want to make sure anybody listening, this is Trevor Crow, Trevor and Friends. This fight at the federal level is Democrats trying to protect you and me. Mm-hmm. I am a citizen of the United States of America, and I have health care because of Access Healthcare.
Yeah.
And thank you, Lucy, for working hard and fighting on our behalf. And this misinformation that is pervasive coming from the other side of the aisle is wrong and misleading. And everybody has to understand, like, I don't know about you, but I will be directly impacted by what's happening. So what can we do to fix it at the state level if possible?
Wow, that is a very, very important issue we're looking at. And it's going to potentially cost a lot of money. And it's, as I said, it's tragic that it's come to this. Connecticut has done a fantastic job for working families here in our state, providing access to more affordable childcare. We did this session, but really my view is we need to address this in terms of how we are going to make healthcare more affordable for residents, so that people do get the coverage they need, so that if they are sick, they can go to the doctor.
Yeah. Oh, my goodness, everybody. Just a reminder, you must vote coming up November 4th. Is that correct?
Yes, this year.
Early voting starts when?
October 20th.
October 20th. You know what? Municipals are coming up. Our next guest is going to be talking about that. But we've had Lucy Dathan, a state representative from 142 Norwalk and New Canaan. Lucy talking about a problem that is really heartbreaking, which is child sex trafficking here in the state of Connecticut, but also our access health, or our affordable health care.
Yeah.
And we really need to take care of that. So everybody, stay tuned. We're going to go to a commercial break. One more thing.
I was just going to say, for your listeners, please make sure that you're paying attention, because the next several weeks we're going to be going into special session. We're going to be talking about this affordable healthcare issue. And so stay tuned to see where we get to.
Thank you. Thank you, Lucy. Talk to you soon. We'll be back in a few minutes.